Welcome to The Explainer. If you're a new parent or caregiver, those first few weeks with a newborn, well, they can feel pretty overwhelming. So today, we're going to cut through all that noise. We're going to break down the essential medical advice for a newborn's first 28 days into a really clear, simple guide. The goal? To help you feel confident and prepared. So, where do we even begin? Let's start with the absolute basics. Understanding a newborn's vital signs is kind of like learning their very first language. It's how they tell us what's going on and how they're doing. So let's decode it together.
First things first, let's get our terms straight. When doctors and nurses talk about a newborn, what does that actually mean? Because the time frame is probably a little more specific than you think. Okay, so the official term is the neonatal period, and it covers the first 28 days of life. Just think about that for a second. That's a baby's first month of adjusting to literally everything outside the womb. Breathing air for the first time, digesting food, even just regulating their own body temperature. It's a huge deal.
And we can break this down even further. That very first week, from day 0 to day 7, that's the early neonatal period. This is by far the most intense phase of adjustment for them. After that, from day 7 to 28, we get into the late neonatal period, which is usually when things start to settle down a bit and routines begin to form. All right, now that we've got the time frame down, let's get into the numbers. These are the vital signs that doctors are always checking, and they really are the first clues to a baby's overall health. First up is breathing. A brand new baby takes somewhere between 30 and 60 breaths a minute. I know, that sounds incredibly fast, right? And it is, way faster than an adult, but it's perfectly normal, and it's all about their tiny lungs and super high energy needs.
And it's not just their breathing that's in high gear. Their little heart is racing too, anywhere from 100 to 160 beats per minute. Just like with their breathing, this rapid pace is just what they need to fuel all that incredible growth they're doing.
And all that energy has to come from somewhere, right? That's where blood sugar comes in, and it's so important. It means to stay above 40 milligrams per deciliter. This is literally the fuel that powers their brain and their body through these first critical days of development.
Weight is another one of those key indicators. Generally, anything over 2,500 grams, that's about 5.5 pounds, is considered a normal birth weight. These other classifications you see here on the chart, they just help the medical team immediately identify babies who might need a little extra support right from the very start.
Okay, so we've got the numbers down. Now let's talk about what actually happens in those first few hours after birth. These aren't just routine procedures. These are the first critical steps in protecting your newborn. This is one you've almost certainly heard of. It's pretty much standard practice in hospitals everywhere. But have you ever wondered why the vitamin K shot is so important? So here's the deal. Babies are born with very, very low levels of vitamin K, and vitamin K is absolutely essential for blood clotting. Without it, they are at risk for a very rare but very serious bleeding condition. So this one little shot provides immediate and, honestly, life-saving protection. Now, this might seem like such a small detail, just waiting an extra minute before clamping the cord, but the timing of this one little action has some pretty significant and lasting benefits for the baby. Yeah, just waiting 30 to 60 seconds lets a lot more of that iron-rich blood flow from the placenta to the baby. It's a simple pause that gives them a huge boost in their iron stores, which in turn helps protect them from anemia in their first few months of life. Pretty amazing, right? All right, now let's talk about what you can actually see with your own eyes. Because for a new parent, knowing what's totally normal is just as important as being able to recognize the signs that something might be wrong. So some things might look a little strange at first, but are completely normal. For example, a newborn's pupils are naturally really small or constricted, and you might see these bluish-gray marks on their lower back called Mongolian spots. They look like bruises, but they're just harmless birthmarks that usually fade away over time. But on the other hand, there are some things that are definitely not normal and require immediate medical attention. And the most critical of these is any sign that a baby is struggling to breathe. You want to look for these 3 hallmark signs: their nostrils flaring out with each breath, making a little grunting sound every time they breathe, or seeing the skin pulling in between their ribs. If you see any of these, that is a clear signal to get medical help right away. Okay, finally, let's cover some of the most important protective measures you can take. These are simple actions, but they are absolutely fundamental to preventing the most common risks to a newborn. This is a pretty stark warning from doctors, and for good reason. Newborns lose body heat incredibly fast.
and they can't shiver to warm themselves up like we can. This makes getting too cold or hypothermia a really serious and often silent danger.
So how do we keep them warm? Well, in a hospital, you'll see them use a radiant warmer. But one of the most powerful and effective methods anywhere is something called kangaroo care. Simply placing the baby skin to skin on a parent's chest is an incredibly effective way to regulate their temperature. And as a bonus, it's amazing for bonding. Now, when it comes to reducing the risk of SIDS, the single most effective piece of advice is also the simplest. Always, every single time, without exception, place a baby on their back to sleep. A newborn's immune system is still a work in progress, which makes them really vulnerable to getting sick. So with that in mind, what is the single most effective thing you can do to prevent an infection? It's the simplest thing in the world, and it's also the most important: hand hygiene. Just washing your hands thoroughly with soap and water before you handle the baby, that is the #1 defense against germs. It's as simple and as critical as that. So we've covered the numbers, the procedures, the warning signs. We have the foundations of newborn care down. But all of this leads to a final, maybe more profound question. What's the most important part of caring for a newborn that you'll never, ever find on a chart or a checklist?